Well, hey, friends, welcome back to the podcast. This is Rhonda. I wanted to share with you a recent addition that we made to Clinical Academy, and that is about a topic that sometimes clinically we kind of get stuck with, and that is what do you do when you don't know what to do? I.e., what do you do when you have that patient that walks in the door and the patient is like, says, Oh, I have the XYZ condition, and you're thinking, Holy moly, I've never even heard of that before. What then? So usually what happens, and I can speak from experience, like you go, oh no, I don't know what this is. I don't know what to do. And then, you kind of buy yourself a little bit of time, not in a bad way, but start with some of the basics. Like maybe you're going to deal with digestion, or maybe there's some blood sugar issues, and you're going to take some time to go research and kind of figure out what it is that's going on and what this new disease condition thing that you are unfamiliar with. And so it's okay to do that. It's totally okay to do that. But when the patient's gone and you have your thoughts to yourself and you have to dive in and figure out what you're going to do when you have no clue, you've never heard of this thing, whatever the patient walks in with, and you really do want to help them, but you have no idea how to do it, that's what we're going to talk about. So I created a lesson inside Clinical Academy about this, and everybody loved it so much, I thought I would share it with all of you who listen to the podcast. So you can get all the details, all the inside scoop about this inside Clinical Academy. And if you would like to join me in there, it's all things clinical. I give you protocols, cheat sheets, references, resources, training, some marketing support. It's all in there if you're a wellness practitioner and you are looking for ways that you can increase your clinical knowledge, feel a little bit more comfortable about the protocols that you're using, and be around other people who have like mind. You can go to rondanelson.com/clinical academy and you can join. All right. So now let's talk back about this. What do you do when you don't know what to do? Well, the first thing that I do, I'm just going to tell you how I do it. The first thing that I do is I go to Google Scholar. I don't like Google in general, but I do use Google Scholar because it aggregates so many different medical publications from all kinds of different things. So I just search Google Scholar, I go there, and then I'm searching inside Google Scholar. I will type in the name of the condition. So it's some, rare genetic disorder, let's say. And I'm going to type in the name of that condition. And then I'm going to see what literature pops up. And it might be from PubMed, it might be, elsewhere. But usually Google Scholar is going to pretty much have US-based research. What I've found is that sometimes we don't always have the best research. Now, that probably doesn't come as a surprise to you, but there are other countries that are doing research, and not all of that research shows up inside Google. So you might use a search engine like a Yandex, Yandex. You do have to translate it into English. There's an option to do that. But Yandex is a great way to get uncensored information. But obviously, Google Scholar is going to be better on your normal browser. But go to Google Scholar to start there and type in the name of your condition. Now, what you're going to do, and you may want to take some notes here. So you're going to write down the characteristics. What is this condition? So describe like how it affects the body. What is happening in the body? And then we want to know what are the symptoms, because sometimes we can use herbs or other nutrients to try and support where there are symptoms, especially like if it's a genetic concern where we may not be able to undo it, but we want to know how to go provide the right support for them. And then what is the presentation of the condition? So how does it present? Similar to the symptoms, but the signs, symptoms, that kind of thing, and then the clinical characteristics. So really you want to read through at least 3 articles. And this is going to take you a little bit of time, but think of this as just an investment in your learning and your education. So you're going to read through those articles and you're going to write down as much as you can, just bullet points. That's all you're doing. You're not writing paper. We're not doing a thesis. We're not doing anything big. You're just going to write down, what is it? How does it affect the body? What are the signs and symptoms, etc. Then you got your list about the condition. And now you're going to write down, what is the patient's symptoms? What is their presentation? So first, we're going to get information about the condition that we know not about, right? We did not know anything about this. Now you are researching, writing all the bullet points down about it. Now you have a kind of a general idea about what may be happening. And we're going to turn the page. We're going to look at the patient. How is the patient presenting? What kinds of signs and symptoms do they present with? Now, I don't know about you, and if it was a case of a genetic disorder, they probably didn't miss it. I can't tell you how many times I've had a patient come in and they've been misdiagnosed. And a classic example of that is being misdiagnosed as having hyperthyroid when they really have autoimmune hypothyroid or Hashimoto's, but they're diagnosed as having Graves' disease. And they don't have Graves' disease, they have a Hashimoto's disease. But because of the way that those antibodies are acting on the thyroid, it can transiently show up or manifest as a Graves' condition. So the patient's diagnosed as Graves', but it's just transient. They're not. They actually have Hashimoto's. So sometimes we miss it, and we miss it just like the medical profession misses it. We all miss it sometimes. So you want to compare what you've discovered about this condition against what the patient's symptoms are, because we want to make sure that we're doing our job. And does this feel like it matches? And if it matches, awesome. If it doesn't match, then you now have some foundational language by which to talk to the patient about, like, have you ever had this or that condition or symptom? Did you start out with a runny nose because you know that that's what it said in Google Scholar, right? In the articles you read. So you may ask those kinds of questions, and you might find that the patient might think they have one thing, but it's not adding up for you, in which case you're just going to go back to Google Scholar and keep digging. But let's just say it does line up. So now you go, yep, here's, condition X that I didn't know anything about. And sure enough, it looks like the patient does indeed have this thing. Yes. Now, what do you do? What are your clinical treatment guidelines? How do you even start to form a protocol? Now, again, in Clinical Academy, I go over all of this, but there are some foundational aspects that, in my opinion, should always be covered. Those are digestion, upper digestion. I'm not talking about the microbiome yet. I'm talking about upper digestion, like adequate hydrochloric acid, exceptional, really good bile flow and output, making sure that the pancreas can generate enough enzymes to be able to break food down. That's key. You cannot heal a body if the upper digestion doesn't work. How are you going to you're going to put them on a really good diet. And if they can't break their food down, what good does that do? It does no good at all. So we have to make sure that that's working. So there are some foundational things you're going to address first. But how do you kind of put the protocol together for this, condition X that you didn't know anything about an hour ago? And now you do. You think, okay, now what do I do? I love using Carrie Bone's approach to this, and it's functional herbal therapy. Think about functional medicine, right? We're always looking for the underlying cause. Now we're going to use herbs. We're going to think about this herbal therapy from a functional perspective. And Carrie Bone outlines a number of different, I'll call them, states or conditions or areas that you may want to look at. So I'm going to read these. I'm going to kind of walk you through these. There's quite a few. So if you're taking notes, just jot these down. Or again, there's more detail in Clinical Academy. The first one is endocrine. Is this condition that you didn't know anything about? We'll just, for the sake of this conversation, we'll call it condition X. So is this condition that you didn't know anything about before, is it endocrine based? Okay, then you're going to put a little check mark. You're going to go, okay, it's in the endocrine system somewhere. Let's say Hashimoto's. Everybody knows about that one. But if it was, we know that's an endocrine condition. The second one is, does it have to do with an underlying infection? And Carrie Bone, and I as well, refer to these as stealth pathogens. So is there a stealth pathogen involvement? Could it be Lyme? Could it be, a food poisoning type situation? Could there have been some overseas travel where someone got sick? So could it be related to something that may be hijacking the body really staying under the radar, but the body just isn't feeling good? Could it be? And we know that most autoimmune conditions have an underlying stealth pathogen or a parasite, a larger type parasite. Something is at work. There's an infectious process. There's something in or on the body that's hijacking the body at the body's expense. So could be a stealth pathogen. Another one that you may want to think about is, does this particular condition need to have more cytoprotection? Meaning, do we need to enhance mitochondrial function? Do we need to reduce danger signals? Do we need to support the cellular health? Is this a dysfunction, this condition? Is it a dysfunction within the cells themselves? Do the cells need more support? Another one to look at is detoxification. What are those NRF2 pathways that we can upregulate in the body? Phase 1, phase 2 in the liver. Does the body just need some more detoxification? I would argue that that's probably going to be the case many times. In fact, that could even be considered as part of your foundational support, right along with upper digestion. You may want to get detoxification working a little bit better. Another one to consider is, does this condition, does it have to do or affect, or do we need to support sleep and sleep quality? So sometimes some conditions, let's just say hot flashes. Hot flashes, night sweats, oh my gosh, that severely affects sleep quality because she's up at night, hot, cold, hot, cold, hot, cold, all night long. So it does affect sleep quality. So that might be something that you think, oh yes, I really need to address this. Now, just as a side note here, remember that you don't have to address all of this at one time. There's no reason to do that. We're going to stage this out, right? You go, okay, what's the most important thing? Well, again, I would argue upper digestion and stress management are probably the two most important things to always address with every patient. But you might go through this list that we're talking about and you might write down 5 or 6 things. You can't do them all, but we're just making notes. That's all we're doing. We're just making notes. Another one to consider is, again, kind of microcirculation and endothelial health. So is this something that we need to address from a circulatory perspective? So what's happening in the vessels, in that microcirculation, in those capillaries? Another thing to consider is the microbiome. Is there dysbiosis? Do we have SIBO? Is there some kind of a pathogen in the gut that we need to work on? Do we have, poor butyrate production? Are we looking at fewer short-chain fatty acids? So that's something to consider. And then digestive health, which I've already mentioned. And how about immune? So we know, like with autoimmune cases, immune function is going to be right up in there, right? And how about inflammation? That's another one. So we may want to consider about how we're going to go about reducing inflammation. If it's a joint condition, let's say, or something, you may think, okay, inflammation, I got to get on top of that right away. This functional herbal therapy approach. Another one is to improve the skin barrier, gut barrier, gastric barrier, sinus barrier, oral barrier, anywhere in the body where there's a barrier, which we have a barrier on the inside tube, right? Mouth to butt. And then we have the continuation of that on the outside, as well as the eyes, the urogenital tract, and the reproductive tract. So you want to make sure that you're thinking about all of those barriers as they apply to this, unnamed condition X. And then lastly, are there any metabolic imbalances? Do we have problems with metabolism and blood sugar and, that kind of thing? So I would like to say that of these things, you're probably going to find maybe 4, 5, 6 that are going to be very applicable to condition X. Okay, you're going to pick your ones. You're going to write them all down. Now, once you have those, now it still feels a little overwhelming because you're like, oh, which one do I start with first? Well, if you muscle test, that's going to be pretty easy for you to figure out. But if you don't muscle test, then you're going to have to just rely on your brain and your intuition. And what that means is you're going to have to decide which one or ones. With someone who's really sick, I wouldn't work on more than maybe 2 things at a time. So if you're going to work, let's say you decide this person's got a lot of bloating, there it's some indigestion and heartburn, that's right away going to be a first spot for you. You're going to go there first. But you may say, well, they do have digestive issues and they have some blood sugar issues, but they also are really in a lot of pain with their joints, let's say. So then you might say, okay, I'm going to work on upper digestion and getting the inflammation out of those joints. That might be your first 2 priorities. And you may want to throw in a little bit of stress management if that's appropriate. But you're not going to want to work on too many things at one time. But by using this approach, this functional herbal therapy approach, it helps you to narrow down what the features are of the presentation in such a way that you kind of wrap your hands around it. You can get around, you can pick it up, you can say, okay, these are the things that I need to address. And then the question is just in what order? And I would say that the order is going to always be top to bottom, inside out, top down. So we want to make sure that we're starting with digestion, but then if you've got like dysbiosis, if you've got an infection going on in there, I would probably put that at the top of the list because I know that once you and I deal with some of these bigger key pieces, they're like the big boulders, then the other things often resolve themselves. And I can't tell you how many times I've had a patient that has had, whatever symptom or condition going on, and I just fixed their upper digestion and got their stress response better, made it better, got it down, and fixed their diet, of course, and maybe 60 or 70% of the symptoms went away. I never even had to deal with all those. So you may make a list of a few things that we just talked about. And then you start at the top and you kind of go, okay, I'm going to do digestion first. I'm going to work with stress because it's part of the endocrine system. I'm going to do that. And I'm going to maybe do a little bit of detoxification or a little bit of microbiome work or do some kind of a gut reconditioning type protocol. You may do that. And the patient's like, oh my gosh, I'm 80% better. You're like, woohoo. Now you go back to your list of the things, the functional herbal therapy list, or those areas that you may want to work on. And you might just check some of them off because some of them don't apply anymore because you've fixed them just by covering the basics. So I want you to know that it's really not about creating big, complicated protocols. We are so good at, I do the same thing. I think, okay, well, and I get caught. And I think, well, we fixed this. I'm going to give you this for this, and then these 2 things for that, and then 1 for that. And then the patient says, oh, well, what about this? Oh, yeah, okay, well, let's do that. And before I know it, they're taking 10 things, 10 supplements. And that makes me crazy. I do not like that. I want to keep it simple. I think the body likes it simple. I think it's better for the patient. The compliance is better. And it's easier for me to manage because then I know exactly what I'm giving, what the target is, and what the outcome is I expect from the therapeutic intervention that I've given, the herb, the nutrient, whatever it is. But when we get too many things, it's like too many cooks in the kitchen, right? We're trying to address too many things at one time. You have to focus on 1 or 2, never more than 3 things, and just work on those. And when you get those done, then you go back and you reassess the areas that are left over. And that's when you go, oh, well, how's your sleep? Oh, I'm sleeping great. I never slept better in my whole life. And you never even did anything for sleep. It wasn't a thing. It's like, well, I didn't give you anything. All I did was fix your digestion and help your stress. Now, all of a sudden, the patient's sleeping better. So then go back to your list and you say, okay, condition X. I know I'm going to need to do some microcirculation and maybe some mitochondrial support. Okay, go do those 2 things now. Maybe that's all that's left. Maybe that's what's going to move the needle and you're going to get the patient over that hump. So you want to give the support for the affected tissues and systems, whatever came up as you were making your list out, and then do it in bits and pieces, meaning don't try and rebuild Rome in a day because your body only can heal so much in one day. And when we give it too many nutrients, it's like, well, what do you want me to do? You're telling me, okay, go down the street, go left, go right, but then stop at the store and pick up those 14 things. And oh, by the way, while you're there, would you just drop this off in the mailbox and go over here? And then, oh, wait, before you go there, go down the street, couple doors, knock on that. There's a really nice lady that lives there. If you want to say hi, would you give her this envelope? Would you see what happens? We're giving so many instructions to the body in the form of these nutrients and herbs, which are powerful messengers. And we're giving so much information to the body that the body's like, I don't know what you want me to do. I don't know what you want me to do first. Can you please be a little bit more clear in what you're talking about so that I can go do the job that you want me to do? Because I can't do the job if you're giving me too many commands all at one time. And that's what happens. We get the cart out in front of the horse and we're ready to rebuild the whole city. And the body can only do so much in a day. So start slow, work on the things that are the biggest priority. Always start with the foundational stuff. Always, always, always start with foundational things. And then keep your protocol simple. Keep it low. Just see how the patient responds. And then you're going to know if you're over the target. And if you need to, keep digging and reading on those articles about a condition or something that's happening in the body that you don't know anything about. It's okay to not know. Everybody can't know everything about all the things, right? So you just keep digging, keep reading, keep researching, and you'll help the patient. I'm never afraid when I get a patient that has something that I don't know about. I just think, oh, well, okay, I'm going to go on a little journey. I'm going to learn something new that I've never learned before. I'm going to learn about this condition. And so you're going to do the same thing. So Google Scholar, write down all the signs, symptoms, presentation, characteristics, all the things from that condition. Then you're going to look at how the patient is presenting to make sure that they match and you've got a good diagnosis. Then you're going to work through the functional herbal therapy approach to identifying what system or dysfunction in the body might be at play. Maybe immune, maybe inflammation, it may be metabolic, it might be cellular health, detoxification, digestion, stealth pathogens, etc. So you want to find the things that are at play with this patient and with this condition, and then start creating your protocol. So it's just not that hard. I think where we make it hard is we think we have to do all the things and we have to have a perfect protocol. Here's what I say. Let's say that you have someone who needs some certain nutrients in their diet, right? They need, I don't know, vitamin A. Well, you could put them on a vitamin A supplement, or you could just have them eat, carrots a couple times a week, maybe include some red bell peppers, orange bell peppers. You could just do a few things like that, give them some foods that have vitamin A, and the body's probably going to be really happy with that. Because I didn't ask it to go on a vitamin A fast, i.e., that's the only nutrient that I'm giving. I'm giving it in concert with other things, and we're doing it slowly. Bodies tend to respond better when we go at it slow, kind of like a massage, right? You get a massage therapist that just takes her elbow and just digs right in, she's going to make that muscle spasm. So we have to go in warm, slow, and soft. Figure out how the body wants to talk back to you in the form of symptoms or no symptoms and improvement. And then you're going to know I'm on the right track with this condition that I didn't know anything about. And if you go along for a month or so and you're not making any headway, that's okay. Because now you know what's not, what isn't. And you can go back to Google Scholar, you can go back to your notes, or you can go back to your functional herbal therapy list. And by the way, there is a book called Functional Herbal Therapy. I think that's the title of it, but I'll link it in the show notes by Carrie Bone. It's a great little book. It's his most recent book. But you can go back to the book or re-listen here to the earlier part of this podcast and just think, okay, well, what else? What else might be at play here that I am missing? The patients aren't going to get any help medically for these kind of functional disorders. So you are their person. You're going to help them, but you can't know everything. You just set that expectation up front. Let them know, listen, I don't know anything about this, but I'm going to go find out and we're going to do this together. And now the patient feels like they got somebody on their team. You're working with them and you're going to say, okay, this isn't working. Now we're going to try this. Let's see how this works. And people are usually really patient about that, really patient because they want to get better. And you would too if you were in their shoes, right? So I hope this was helpful for you. I love being able to share clinical and marketing, business, all the things that I know are working or not working right now. And I hope this is really helpful for you. So if you ever need anything, if there's anything I can do to help support you in your clinical journey, you can always reach out, support@rhondanelson.com. I will link Carrie Bone's books in the show notes. And then again, if you'd like more help clinically, you're feeling stuck, you are new to functional medicine, or you're new to this world of, alternative medicine or alternative options, I got you, friend. Just go to rhondanelson.com/clinical academy and you can join. There's no long-term commitment. You can join for a month. And if it's not your jam, cancel. It's okay. I'll be sad that you left, but I get it. I'm not the right flavor popsicle for everybody. So I would love to help you if I can. So again, thank you so much for listening. I love doing these podcasts for you, and I hope that they are as beneficial for you in your practice than they help you be able to grow and serve and help more people. All right, friend, take care. I'll see you next week.